Hello, this is Dr. Gay from First Look MRI, and this is one of two brothers. They're twins, both juniors in high school, and they both play football, and they both have shoulder pain and instability. So this twin brother has an MRI of his left shoulder. This is his left humeral head. This is his left glenoid, part of the scapula. Scapula comes all the way across here, and it flares out. And this is the glenoid component, or glenoid portion of the scapula, and it should look like a golf tee. And his humeral head here looks like the golf ball. And this patient has a couple findings. Number one, there's fluid in the joint, which is white from arthrogram. We see his posterior labrum, which is this little dark triangle back here. It goes around the rim of the glenoid, rim of the cup here. His anterior labrum, though, is torn. We see that little dark area. And there's contrast injected that goes out underneath the torn labrum. The torn labral tissues are uplifted a little bit from the glenoid. And so this is a patient who has an anterior and adjacent inferior labral tear. When we see a tear in this location, we think about a dislocation, and we look up here at the top of the humerus, and sure enough, near the top of the humerus, there's a little area of brightness, a little scalloping. So it looks like this patient may have had an anterior inferior shoulder dislocation. The shoulder went forward and down, impacted with the anterior inferior rim of the glenoid here, and tore off the labral tissues. This dark area here is the middle glenohumeral ligament that is intact. Sometimes that will tear. So again, this is looks like a Hill-Sachs impaction injury with a what we call a fibrous Bankart lesion, which is a tear of the soft tissues over the anterior inferior glenoid. And I do not see a definite fracture of the glenoid rim. The labral tear also went up into a superior labrum. So right here, this little white line, that is contrast going into a torn superior labrum. We can see that labral tear right here. Here's the humeral head. Here's the glenoid, here's the superior labrum, and this little bright signal or contrast there extending up into the superior labrum. So tear of the anterior and superior labrum, and it looks like a shoulder dislocation, an anterior inferior shoulder dislocation. Now we're going to go to his brother, also done today, right after him. And here we go. So his superior labrum is intact. This is his humeral head, this round ball. This is his glenoid. And we're going to look at this patient and see that he has a problem with his posterior glenoid. So the front of the glenoid has a nice pointy triangular configuration, and the posterior glenoid is rounded and blunted. So there's a fracture of the posterior glenoid. Looks like a chronic type fracture. And the bone fragment is there. Over the top of it is the posterior labrum. So this looks like an impaction injury from playing football. Sometimes the athletes will hit someone with their arms out, and it'll shove the humeral head backwards. It'll impact into the posterior glenoid rim here, and they can get fractures. And with that fracture, the posterior joint is unstable, and we see this patient has a humeral head that is not in line with the glenoid. The epicenter of the glenoid is here. The humeral head epicenter is here, so it looks like there's posterior subluxation of the humeral head associated with posterior shoulder joint instability. And again, this is that bony fracture with a tear of the overlying labrum. The white is the fluid injected into the joint. We see that fluid go between this fracture fragment and the rounded, blunted glenoid rim here. So a tear of the posterior glenoid and labrum related to football injury. He also has a marrow edema up here. This is a little bit lower than we typically see for the Hill-Sachs injury with the anterior inferior shoulder dislocation. This may be related to tugging of the posterior rotator cuff as it attaches to the bone here. And that's it. So two brothers with two labral tears and bone injuries, but it looks like this is a posterior shoulder dislocation with a posterior labral tear, and the other patient had an anterior labral tear related to an anterior shoulder dislocation. Thank you very much.